Good day, this is Maria Remedios P. Caballero, your student nurse from University of Mindanao.
Neuro vital sign monitoring.
For today's video, I will gonna show you the step-by-step procedure of neurological assessment.
Neuro vital sign monitoring to assess the integration of brain function and motor response.
It includes the eye opening, motor response, and verbal response. So the materials needed are pen light and a neuro vital sign monitoring sheet. First is that you need to check and follow the physician's order.
The rationale for this is to prevent error. Wash hands. Hand washing deters the spread of microorganisms. Identify the client.
So, pwede ba niyo i-iwan yung pangalan, ma'am?
Catherine Bernardo, please.
Catherine Bernardo. Check mo ID ka, ma'am, ha?
Check the vital signs for baseline data. Eye opening.
If eyes are closed by swelling or surgery and are unable to be opened, score 1 and indicate with an 1C or a C in the no response none section. If one eye is closed, document the response from the functioning eye.
Spontaneous eye opening, which opens spontaneously, score 4. To speech,
Ma'am?
score 3 if the eyes
Ma'am?
open due to verbal stimulus. To pain, if the eyes open due to pain stimulus, score 2. No response, score 1 if there is no eye opening to any stimuli. Best verbal response.
If the client is unable to vocalize due to the presence of endotracheal tube or a tracheostomy, score 1 and indicate with a 1T or a T in the no response none section. If the client is able to verbalize despite the presence of a tracheostomy, enter a T in the appropriate section.
If there is a language barrier, document language barrier across the section. Oriented, score 5. If the client answers all of the following correctly. Person, place, time.
President Rodrigo Duterte.
So, karon ma'am, asa man ka?
Nako sa hospital.
Unsa man tang bulana ug tuiga karon ma'am?
Ano ka lang, February, tapos 2022.
Ma'am, kisa ta president karon ma'am?
Confused. If the client is disoriented, score 4.
Asa ni David Nurse?
Unsa man tang tuiga karon ug bulana?
December 1992?
So, ma'am, kisa
Inappropriate
president ato
words.
karon ma'am?
The patient clearly articulates word, but his or her verbal responses bear no relation to the
Asa man
context
ka
of the
karon, ma'am?
orientation questions.
Saan mo nurse? Ay,
Score 3.
Uy, labi ako.
Incomprehensive sound. If the client fails to articulate words but does utter sounds, score 2. Score 1 if there is no verbal response to any form of stimuli. Best motor response.
Ma'am,
Obey
can you
commands.
show me your thumb?
Score 6 if the client is able to understand and obey verbal, written, or gestured commands. Localizes to pain. Score 5 if the client moves a limb in attempt to locate and remove the source of painful stimulus. Flexion withdrawal. Score 4 if the client withdraws the limb in response to a painful stimulus by flexing at the elbow or knee. Abnormal flexion to pain. Score 3 if the patient flexes the limb at the elbow in response to painful stimuli. Extension to pain. Score 2 if the client extends the limb at the elbow in response to painful stimuli. No response. Score 1 if no movement of the limbs occur in response to painful stimuli. At this point, add the numbers from each section, eye opening, best verbal response, and best motor response, and document in the total section of the record.
So that's it. Again, this is Maria Remedios P. Caballero, your student nurse signing off.